Hello, everybody, and welcome to another edition of On the Clock with Personal Living Alert. I'm David with Personal Living Alert, and today we're going to be talking with Miss Jean-Louise. Miss is with Devoted Health Insurance, and they are an up-and-coming health insurance company down here in Florida. And she's going to talk to us about what's going on in the Medicare insurance world that she lives in every day. Morning, Miss, and how are you today?
I am absolutely fantastic. And thank you so much for having me, David. And certainly I consider it a pleasure to be here. And, you know, going through and living through this whole new normal has been exciting and, you know, scary at times, but more importantly, it's been rewarding as well, because I've been able to be a resource of helping people. And that's been pretty amazing.
That is always great. When you can help somebody out, it gives you the best feeling out there. You know, I always like to start these things with, what's your background? I mean, have you always been in insurance? And then have you always been in the senior aspect of insurance, the Medicaid, Medicare market?
That's a great question. And I'd like to tell people my why, and why I'm so passionate about what I do, and just a little bit so that you get to know why all of that matters to me. I have been in the industry, in the healthcare industry, licensed insurance agent for a little bit over 15 years. And prior to that, I was the power of attorney for my grandmother, which was about 13 and a half years. And so she actually had a lot going on health-wise. You know, she was a diabetic. She ended up with renal failure. She had a lot of, you know, other conditions such as high blood pressure or elevated cholesterol. And so therefore, it required me to really see healthcare through a different lens. And so I got to see up close and personal the gaps and holes in healthcare, but I also got to see it as my profession, the professional side of, again, sometimes where those gaps and holes are too. And so for me, it matters that our community of seniors, those that are on Medicare, that they are taken care of to the highest level, and that they are getting the care that they need and deserve, and most importantly, when they need it, because of my grandmother. So she is part of my why, to take it just and not to be, to give you too much, but as the eldest granddaughter, I really got to dive in and help my grandmother and help her navigate the complexities of healthcare. And so that's why I love doing what I do on a daily basis.
That's a really nice story. It really is. Now, I know you're with Devoted, and Devoted, it's a relatively new insurance company. I think a year, 2 years old or something like that, maybe a little bit more than that.
3.
You're 3 years old now? There you go. I missed the birthday. And I know you guys are primarily Medicare. What separates Devoted from the pack? What makes you guys unique? What's your unique selling point?
And it really is everything that I just kind of shared with you. Devoted is such a unique company in that although our company is only 3 years old, like I said, I've been around and was with my last company for over 10 years. And I never really thought that I would leave unless I was going to work for myself. But what really impressed me with Devoted is that the mission at hand is to be easy, to be affordable, and really just put the heart back into healthcare, right? And so the leaders of Devoted, they're not new. Trust me, if you do the research, the leaders have a plethora of knowledge behind them that's really driving our company to unimaginable heights. And part of that is making it something that's really unique. Like we have our member service guides, and our member service guide teams, they're like little mini superheroes that are working behind the scenes. So to give you an example, so many of us, when we're calling customer service, be it insurance or credit cards or what have you, right? We're on hold for a long time, and we don't really feel valued because we have to hold. Well, Devoted actually, when you're calling our member service guide team, it's a three-pronged approach whereby you are not only getting someone that can answer questions, billing and typical member service questions, but you also actually have a clinical aspect, and then you have the social services aspect of our guide team. And the whole time, 80% of our calls are answered within 30 seconds. When you go up to a minute, those calls are answered within a minute so just making sure that we're answering the calls, we're doing right by our members, and we're allowing technology to drive that. And at the end of the day, the one thing that I just want to just say, and to give you an example of all of that, in the midst of this COVID virus that we're living in, this pandemic that we're living in, Devoted's mission was to touch roughly 17,000 of our members. We literally, as an agent, as a licensed agent, not just touching my personal members, but as a company, we called every single member to check in, to make sure, to find out if they had any COVID-related symptoms, to find out if they had any food insecurities, and actually provided them with resources to get those foods, whether it was delivered or what have you.
Okay. It's very good stuff. So with the COVID-19, from a global insurance perspective, is Medicare providing any changes or enhancements to coverage? Should everybody who watches us know about anything that's coming up?
Yes. So great question. Obviously, because of the times we're living in right now, with the CDC guidelines, of course, as well as with Medicare, you can actually get COVID testing at no additional cost. Even if you do have Devoted or any plan, there's no Medicare plan, there is no cost to actually be tested for the virus. And so, that's good for people to know, because sometimes they may not, want to get tested out of fear of cost. So
Right.
we're eliminating that.
And I saw that a lot of people have that hesitancy. Is it going to cost me? Is it not going to cost me? I know there are a lot of free drive-throughs, but they're limited. And I know there are other organizations that are definitely charging. So it's good to know that if, you don't, there's other ways around it. Medicare is taking.
Correct. Right.
Now, COVID-19 really impacts the senior community. Right? I
It
think
does.
I was reading somewhere like 1 in 4 cases are hitting our seniors. Now, with that comes an increased medical expense, right? I mean, they're going to hospitals. God forbid they get put on ventilators and things like that. I mean, with the costs going up, do you see any increases in the cost for Medicare coming up in 2021? What are you guys seeing for the future?
Well, what I can say to that is that, I don't have that crystal ball to determine what the cost will be. But what I can tell you is this, is that because of the way that Devoted structures its plans, and the way that a Medicare Advantage company like Devoted is in fact paid, we are paid by making sure that we're doing the best by our members, meaning creating a plan that's going to be budget friendly to many individuals, so that is one less thing that they have to worry about. They can feel confident in knowing that they're going to have a plan. They're going to be able to reach out to me as a licensed agent to determine, if I can help them, I will. It's kind of like my tagline. I tell people all the time. I always say, if I can help you, I will. And if I can't, I'll tell you that too. And just really kind of analyze their case and to see, can I help them save money? Sometimes people they're able to qualify for extra help and not even know it. And especially because of COVID, many seniors were still working that may not be working any longer to have that additional income. So this would be a great opportunity for someone to reach out to me to kind of do an analysis to see if there's additional resources that's available to them.
All right. What do you see from an insurance industry perspective what's going to be the new normal? I mean, do you think that people always be wearing, say, masks when they go to the doctors, or when people are just around from, globally, what do you think's going on?
From a personal standpoint, I believe that this is something that we've never in our lifetime experienced, right? And so I think for most of us, we are going to proceed with caution, and whether that's being, consistent with wearing mask. I just think we will, going forward, and especially until there's a vaccine available, that will proceed with caution, and obviously with good reason because of the data.
Right, no doubt about that. I talk to my wife all the time, and which is probably a good thing. And I'm sure you talk to your husband and things like,
Yes.
when are you going to be comfortable in going outside and returning to normal? I mean, when do you think that's going to be? And I don't
To
know.
David, the truth of the matter is, I think, and I, and I don't know if I'm right or wrong on it, but I don't believe that we will ever go back to normal, right? It'll be our new normal, a new way of doing things, because I think we'll all still have that in our mind for a very long time. I just think it'll take time before we get there, and that's just because, you know, there's, you just don't know who has the virus. You don't know, um, until we can actually have that vaccine, and at least saying, okay, well, I have the vaccine, because you've heard cases where people have been reinfected,
Yeah.
right? They've had the virus and then they've been reinfected. So those are things that I think about. But I must tell you, because I'm normally out in the field assisting, the Medicare population, that I will just be a little bit more mindful. Like, I'm a hugger, to give you an example. I am, I love, hugging, just because I think hugging is infectious, and it's like transferring good energy and sometimes receiving great energy as well. And so I will have to think twice about, when I greet us, someone that's a senior, or maybe a compromised immune system, about hugging them, right?
Exactly.
Because, so that those are things that I think about, that, I will have to do a little differently.
Are you ready to go out to dinner and sit next to somebody? Are you ready to go to a
I'm
movie?
not there yet. I mean, I love the food. I love going out to dinner. God knows I love that. My husband definitely knows I love that. But I'm not there. I'm not there. What about you? How do you
Uh,
feel?
it's going to be a long time. I mean,
Yeah.
a long time. We are ultra cautious. We sanitize everything that comes into the house. We wear masks no matter where we go, gloves everywhere we go. I don't know when we're going to. We used to go to bars to listen to live music. I can't tell you when we're going to do that again or anything. We're
Yeah. Yeah.
definitely waiting.
Right, right. Yeah, and that's really what I was saying, that, it's going to take a while for I think, most people to get to that point. Now, there are some people that will just get back in to business as usual, but I'm definitely, going to be proceeding with caution, just not for self, but for the people that I serve.
And I agree with that 100%. Miss, your name is just so cool and so interesting, because I say Miss, and I'm thinking I'm talking to a woman walking past me, not to you, right?
Right?
So, Miss, you're a wealth of information when it comes to insurance, right? So, if somebody had a question, whether it's related to your company or just a question in general from insurance, they just want a little information, how could they get in touch with you?
Absolutely. And you hit the nail, on the head, David, in saying that, it doesn't have to be about insurance. That's where my expertise lies. But just give me a call. I can be reached at 954-547-7491. Um, and that's my cell actually, and I would be more than happy to assist you and guide you. And at the end of the day, my commitment to each person that I speak with is to try and actually be a resource, number one, and leave them in a better state than how I found them. So if I can add value to their lives, then that is my mission. And so I thank you very much for giving me this opportunity to chat with you today.
Always, and I'm very glad you're on. I truly appreciate the time. So enjoy your day, okay?
You as well.
All
Have a
right.
great one.
Thank you. Bye-bye.